Brainstem lesions affecting reticular formation can cause impaired consciousness. Ischemic or hemorrhagic strokes, inflammation or infection, tumors, hypoxia, toxins, secondary brainstem compression due to coning, like from the millicerebellar artery infarction or large massive cortical hemorrhage can cause drowsiness. It is very important for us to know about the ways to gather information of an unconscious patient. If there is an eyewitness, it's easy. The ambulance staff, paramedical team, or police might give you some information how the patient was found to be found by them or was taken from a place of incidents. Previous notes, diagnosis cards, and documents may be available if the patient is brought in an ambulance, or sometimes when the patient may carry some of those. You can give a call to caregivers if we know them, or if the contact numbers are available, or the family members. However, we can easily contact the doctors if the patient is transferred from another hospital. Then sometimes we have to depend solely on examination findings when none of those details are available. So let us see what clues uh, can be there for different etiologies. Coma scale, of course, will be examining them, and then uh, if the patient has neck stiffness, you have to think of neck injury, meningitis, or subarachnoid hemorrhage. In fact, if you suspect the patient has had an injury to the neck or head, then you should not look for neck stiffness. Focal neurological signs will indicate some focal structural lesion. Depending on the onset, we may have to think of different etiopathologies. Temperature, if there is a very high fever, it may be an infection or sometimes neuroleptic malignant syndrome if in the case of a psychiatric patient. Sometimes large brainstem lesions also can cause hyperpyrexia. Hypothermia is uncommon in Sri Lanka as it is, but myxedema coma can present with hypothermia as a part of the syndrome. Alcohol and poison smell may be useful to diagnose or suspect it, and bleeding from mouth may indicate either head injury or generalized seizure with tongue bites. You must always look for head injuries even if there are no external evidence of a trauma. You must see whether palpate the scalp and see whether there had been any uh, contusions or even fractures. Blisters are supposed to be a feature of barbiturate position, which is now uncommon in our country. Tongue bites, as we discussed earlier, also indicates probably seizures together with lateral mucosal injuries in the mouth. Blood pressure, pulse, and heart rate need to be examined, and they might give an indication of whether there had been any cardiac event causing hypotension and whether the patient had been drowsy or unconscious due to that. Respiratory system is examined to look for abnormal type of bleeding which may indicate the site of the lesion, and you must always look for aspiration pneumonia also in such patients. Now, if we can have a very minimal information, still there are possibilities of suspecting different illnesses. If detailed history is not available, but if the onset and progression is known, that will also be useful. The circumstances, previous health, psychological factors or disorders, social history, especially with regard to their habits, may be useful in thinking of a differential diagnosis. Now we'll take some of those circumstances. If there is a patient who has been previously healthy and had a rapid loss of consciousness, or if the patient is found to be unconscious in the morning, or maybe on a bed, roadside, or in a supermarket. The conditions of sudden onset should be considered like subarachnoid hemorrhage, intracranial hemorrhage, or trauma. Arrhythmias and myocardial infarction can cause sudden drop of blood pressure and the patient may be unconscious thereafter. Hypoglycemia also can cause sudden impaired consciousness noticed in the morning, especially if the patient is ethanol abuse or a patient with diabetes. Those who take insulin are more vulnerable to hypoglycemic attacks, sometimes unwitnessed during sleep and found to be unconscious in the morning. Intoxications, especially alcohol, can also cause uh, sudden unconsciousness at night, and the patient may be found to be unconscious in the morning. If the patient is previously healthy and the loss of consciousness has developed over a few days, then you have to think of infections, especially if there is fever, metabolic derangements like hepatic or uremic encephalopathy, stroke, electrolyte abnormalities, myxedema, coma, etc. Subdural hematoma generally develop over several days or weeks, but occasionally, if it's very rapidly filling, it may develop over a few days. If the level of consciousness was deteriorating slowly over a few weeks or months, then tuberculous meningitis or any other chronic infection, secondary deposits, space occupant lesions of uh, very rapid growth, and other chronic infections can cause impaired consciousness. If there is a history of a seizure before loss of consciousness, it may be postictal drowsiness or sometimes continuous non-convulsive status. If the story is sudden fall clasp in the head, this may be subarachnoid hemorrhage or intracranial hemorrhage. Diabetic patient missing meal coming with hypoglycemia is not uncommon. Psychiatric patient, previous history of attempted suicide, you have to think of overdose and other causes of attempted suicide. Vague ill health, abnormal behavior before may indicate space occupant lesion or tuberculous meningitis and other chronic infections. Fever, headache, and fits may indicate encephalitis or meningitis. On examination, we have discussed earlier also that the fever indicates encephalitis or meningitis, neck stiffness, subarachnoid hemorrhage or meningitis. Acidotic breathing may be a feature of ketoacidosis, which is an uncommon cause of unconsciousness unless the patient is severely dehydrated. Dehydration and hypertension we have discussed earlier. Arrhythmias can cause sudden drop of blood pressure and the patient may have a cardiac syncope, but if it is prolonged, the recovery may take longer time. You must look for evidence of poisoning, chemical burns around the mouth and the smell of the poisons. Bruises, laceration, etc. will indicate head injury. And as we discussed earlier, oral mucosal injuries and tongue bites may indicate a seizure. Focal neurological signs, will indicate a focal structural lesion. Now, examination of unconscious patient is a challenge. You must look for trauma, telltale marks of a seizure, evidence of poisoning, evidence of chronic illness, and evidence of substance abuse. System examination, nervous system by far the most important system, but examination of nervous system in such a patient is very difficult. Coma scale you can assess. If there is no contraindication, you can look for neck stiffness. If the patient is not responding to your command, you can detect eye movements by doing doll's eye movements, turning the head to both sides, but again, you must exclude head or neck trauma before doing this maneuver. Facial asymmetry can sometimes be seen spontaneously or with a painful stimuli. Optic fundi, because if it shows papillema, puzzle is quickly solved. In the motor system, we can look for asymmetry of muscle power, tone, and reflexes, and plantar response. Cardiovascular system and respiratory system may indicate abnormalities of rate or the rhythm or pattern of breathing. Management of unconscious patient may depend on the etiology and the cause of the unconsciousness. However, there are many things which any unconscious patient need to be given. All these patients should be assessed at acute stage for airway breathing and circulation, and the specific management of diagnosis is needed in it is as soon as it is diagnosed. All of these patients will need monitoring and correction of fluid and electrolytes, similarly blood sugar and oxygenation. There are certain things that we do for any patients with unconsciousness, regardless of the underlying specific diagnosis. Of course, very important aspect of management would be to discuss the situation of the patient with the family and be realistic and truthful about his condition. Then if the patient recovers, then rehabilitation should be planned. Okay. As soon as the patient comes in, there are few urgent investigations to be done which are needed for resuscitation. For example, pulse oximetry, random blood sugar, and if possible blood gases need to be done early, and then the resuscitation started immediately. Certain investigations will be useful to arrive at a diagnosis, like electrolytes, creatinine, and liver function also may be useful for diagnosis. And if there is no obvious diagnosis, you must always do a CT scan of the brain. And EEG is useful if there is a suspicion of a seizure or postictal status. And in youngsters, especially, the drug level should be assessed. Urine toxicology screening is done now in most of the hospitals on admission. You have to look after the airway, breathing, and circulation, but do not move the neck if trauma is suspected, and oral feed should not be given until the patient is fully conscious. After airway, breathing, and circulation, you must correct hypoglycemia. An important point here is if the patient is malnourished or chronic ethanol abuser or pregnant, then intravenous thiamine should be also given with 50% dextrose. We have to correct the volume if the patient is hypovolemic, correct electrolyte, maintain the blood pressure, should not go up or down, control seizures if there are. Now the favorite drugs nowadays is levetiracetam, but others also can be as effective. Antibiotics should be given after taking cultures whenever there is a strong suspicion of an infection. Different hospitals and units may need to develop their own pathway how to work on this uh, patient with unconsciousness, uh, depending on their resources, both human and physical resources. So it's always better to have a team, because one person, single person, cannot manage this patient while the doctor is attending to the resuscitation. The nurses can take blood for investigations, and others can arrange an EEG and so forth. But all depends on the situation of the hospital. During unconscious period, all the patients need to have a program to prevent bed sores like turning, pressure points, skin care, and prevention by uh, air mattresses and so forth. Bladder care should be attended to. You must always prevent aspiration pneumonia and hypostatic pneumonia, which is very uh, detrimental to the survival of these patients. Nutrition, we'll discuss again, need to be attended to in malnourished patients from the day one. Others, well-nourished patient can wait for about 1 week without much of a nutritional support. Physiotherapy should also be arranged. One thing is to prevent pneumonia, hypostatic pneumonia, and aspiration pneumonia, and also to prevent contractures developing. If there is suspicion of raised intracranial pressure, intracranial monitoring would be ideal but cannot be done in all the centers. Mannitol infusion would be useful. Some people use even furosemide or 3% dextrose. In 3% saline. Dexamethasone is useful in tumor-induced uh, edema, cerebral edema, and in cerebral abscesses, of course, if antibiotics is given prior. Hyperventilation is another strategy, and if all fails, you have to do a craniectomy and remove part of the skull to reduce the intracranial pressure. Nutrition should be attended to if the period of unconsciousness is prolonged. You can use enteral feeding as in most of the hospitals in Sri Lanka, but um, for patients with prolonged uh, unconsciousness may even need parenteral nutrition. So, in summary, unconsciousness is due to bilateral hemispheric lesions or brainstem lesions above ones. And coma scale, Glasgow coma scale should be used to assess the level of consciousness and to document it so that it can be monitored easily. We have to use all the available resources to find out information about the patient to come to a diagnosis. When you are examining the patient, all the possible differential diagnosis should be considered, and you must do investigations, sometimes limited investigations, but keeping in mind all the possible causes of unconsciousness. Until the specific diagnosis is made, vital function should be maintained and complication should be prevented. Thank you.